With us in the studio is Fazal Ahmad. He's the Global Operations Director from the charity Humanity First. Thank you so much for coming into Arise News, because your charity is extremely busy because you've just been battling with the Ebola crisis.
That's right.
So just back from there, now we've got the crisis in Nepal. Can you tell us a little bit about Humanity First and exactly what you offer people?
Sure. Humanity First has been going for 20 years. We're a group of volunteers worldwide. We've got around 100,000 volunteers to pull from, experts in education, healthcare, water infrastructure and so on. And our focus is on capacity building and skills transfer in low-income countries across Africa, parts of Asia, Latin America, Caribbean. But we also, a third of our work is disaster response. And you know, we've been going for 20 years. This is
You're
just
well
the latest.
versed.
This is the latest earthquake we've had to respond to, unfortunately.
And so, when it comes to coordinating a team of volunteers, what are the biggest challenges there, especially in an area like Nepal, where a lot of the regions that have been affected by the earthquake are quite remote?
So, in order to ensure that you get a multidisciplinary team working in a consistent way, we actually train people. So, funny enough, 2 weeks ago we were training people in Leicester, and 4 of those people have gone out to Nepal. We had people go out from Moose Jaw in Canada, and they also had been on the training a few years ago. So when they go out to theatre of operations, they already know how to work together. But we also had 80 volunteers from India join our team. So we've got about 94 people out there, and they all understand our modes of operation.
As I understand it, your team has been sent to the epicentre of the earthquake, where people have been, well, not receiving as much aid as they should, as quickly as they'd have liked. The response has been reasonably slow, but that's because, I understand it, that the weather has been very poor, colder than it should be, wetter than it should have been, and of course we've got the onset of the monsoon as well. You have many things to deal with. Are you getting local help there as well, people to show you the way?
We are, and in fact, when we started, you know, we're not registered. We're registered in 43 countries, but not in Nepal. So there were a couple of organisations on the ground. One was Amdia Song Nepal. The other one was the Lord Buddha Children's Health Foundation. And they, with their local knowledge, we were able to get people in and also work out where to send them, where the greatest need was. In fact, when they landed in Kathmandu on Wednesday afternoon, there was another tremor at that time, and so. You know, it was quite difficult. There were landslides going on, there were aftershocks, the roads were congested or broken in places. It took, even from Kathmandu to the Gorkha region where we're working, it took us the best part of a day to get our team out there.
Much to think about in terms of risk then, Fazal. We've got some pictures that some of your team have sent in to us, so we can have a look at those now. Just describe to us some of the work that they're doing here.
So this is Dowd Chow, who's the lead of our team, and Dominic Morgan. They all work in the NHS, and they take a week or two off work and away from their families. These are some of our volunteers from India. And whilst we're working out there, we set up a field hospital near Gorkha, and we're supporting a number of the surrounding villages as well. But it's not just about providing medical aid, it's also, you know, providing counselling, especially for the children who've suffered a heavy trauma and seen family loved ones pass away in front of them. You know, it's quite difficult for them.
And of course, some of these people have probably never seen a doctor before, full stop. So you also got those sorts of challenges as well. Well,
exactly. I mean, the region we were working in, there were 2 district hospitals for a population of almost 300,000. We went to some of the remote areas. We had a medical team roving about as well. And some of those people had never seen a doctor, never. So it's important that in the way that we work, we don't suddenly give them very exotic medication, because then when they don't get that topped up, their body actually gets into a worse state. So we have to be very careful how we work in these kinds of situations.
When it comes to some of the health issues that you have to face, disease, dysentery, cholera, anything that's sort of, I guess, related to those, what are the biggest worries from your team?
The worries are more to do with culture. So if you think back 5 years ago to the Haiti earthquake, we had a total of 160 medical folk who went out over a period of 6 weeks. And everyone thought the situation was under control, but then waterborne diseases like cholera set in. And the biggest problem was trying to quickly get around all the villages and explain to people, don't go to the river and take the water, you know, filter it in the following way. Now, it's the same thing that we're going to have to do here. It's the after effects. Luckily, up in the Himalayas, they have got access to clean water as well. But there is a possibility that there will be, you know, diseases spreading, especially since in some cases, 90% of the houses have been destroyed.
So there's many roles that your volunteers are taking on here, not only giving aid, but also education in a way as well. And the Nepalese health system was very stretched even before this earthquake, so your teams could potentially be there for a long time to come yet.
Well, our approach, I mean, we work across all of Africa as well, and our approach is skills transfer and capacity building. So we would like to help the Nepalese to train up more midwives, more doctors, more nurses, use our expertise to get them off the ground quickly. But our phase 2, and we're rapidly starting to put plans for the next phase, is really going to be around reconstruction. So many, I think we're talking at least 200,000 homes have been totally destroyed. That's going to be a big focus for us.
And have the Nepalese and have the people of Nepal been completely overwhelmed by what's happened? No one has been prepared for this at all, have they?
They are totally overwhelmed, but I have to say their resilience and their attitude is amazing, absolutely amazing.
I was going to say probably a lot better prepared than we would be here sitting in London to cope with this sort of thing as a community, because it is very much communities together out there, isn't it?
That's right. I mean, here, if a mobile network goes down, we're all panicking.
Yeah.
They are used to living in difficult conditions. They're used to the lights going out. They're used to the water getting clogged up. But obviously, the biggest hurdle here is the fact that the buildings have been destroyed and the roads are damaged. And so getting around to these areas, this is why, although the death toll is currently reported to be around 7,500, it's going to go up. As we get to the outlying regions, we'll get the true picture of what's happening.
How much of your job relies on effective communication? I know you're doing some fantastic work in terms of educating the people out there of what they need to do in certain disaster situations and how they should live to live safely. But when it comes to communicating to the media, to people around the world about what you're doing, how difficult a task do you have?
Well, we're all volunteers, so our money goes a long, long way. We say that around 93–94% of our funds go directly to the field, because even for the team that's gone out today, and I was in Uganda a couple of weeks ago, we've had teams working with Ebola. They pay their own way. They pay for their flights, visas and everything. And when they're on the ground, we then make sure that all their transport and accommodation is covered. That means that our funds go a long way. But as a small charity, we don't have the infrastructure to do fundraising on that scale. So we rely on small amounts of funds and individual donors to help us tick.
And just remind us how many people you have on the ground working in Nepal at the moment?
94.
Okay.
2 from Canada, 12 from the UK, and the rest from India.
Best of luck with everything. Hopefully you can come in and talk to us more about the work that you're doing in the coming weeks. Thank you very much, Fazal Ahmad.
The team will be back in 2 weeks, so you can speak to them yourselves.
Fazal Ahmad from
Thank you so
Humanity
much.
First. Thank you very much.
Pleasure.